From the final two governors, I want to bring my top advisor on health equity and Governor Marcella Nunez-Smith. And Governor, I made her a governor, doctor. I'm not sure whether you view that as a promotion or a demotion, but I think it's a promotion. But at any rate, tell us what's going on and give us a quick overview of the work you've been doing to ensure the equity response, because we've been told that, that in fact, anyway, I'll let you do the talking here.
Thank you so much. Good afternoon, Mr. President. Good afternoon, Governor. It's just so very good to be with you today. I want to echo and thank you so much to you, all your teams, all that you're doing to center equity in your vaccination campaigns. As you've even referenced, it's important for us to hold a very broad understanding of the many groups that have been hard hit by the pandemic. Just for the minutes today, though, I want to focus in on race and place, on people of color and rurality in particular. And I want to share some of what we're finding in the federal vaccination channels. From the very beginning in those channels, it was key, as you all have done, to take a very intentional approach to center on equity. In the federal program, that meant taking a place-based approach. We recognize in our country, zip code is still a stronger predictor of health than genetic code. And so we anchor in location and place to make sure that we're getting those resources to the hardest hit and highest risk communities. So setting up direct allocation to our country's community health centers, and including to rural health clinics, to local independent chain pharmacies, and of course, to the community vaccination centers. And as so many of you have referenced already, supporting mobile capacity. That is key to meeting people exactly where they are. So I want to share with you some of the demographic data. We have high quality demographic data that lift up and echo the need for data to drive our response. And so in the federal vaccination channels, what we see is encouraging. About 70% of vaccinations at community health centers have been administered to people of color. And that number is 60% for the community vaccination centers. And those are all of them located in hard hit communities. Over 40% of the pharmacies in the federal retail pharmacy program are located in high risk areas. And if we look in the last 2 weeks, over 46% of those pharmacy doses have been administered to people of color. So of course, there is absolutely more work to do. As you all illustrate, equity work, reaching to communities, that's hyper-local. So key to recognize that communities are the experts in what they need and to partner. As the examples have really showed, partnering with trusted local community leaders is a must. So we're all looking forward together as the vaccination efforts charge on prioritizing access, focusing in on ease and convenience, and addressing those structural barriers we begin to talk about, making sure people have the opportunity to get connected to vaccine without an appointment, making sure that there is paid time off for vaccination and any recovery time, and thinking about other things like transportation and providing that assistance. So in addition to making sure that everyone has access to vaccination, we have to make sure they have access to the accurate information about vaccines from the people that they know and from the people that they trust. So making sure that everyone, that is every person, every community, can benefit from this scientific discovery. And we could all agree that's how we all together get to the other side of the pandemic. So just as I wrap, I want to say, we know equity does not happen by default, and it never has. So thank you for all you're doing, for sustaining this commitment, and of course, for your leadership.
Well, thank you very much. And now I want to bring in